Alright, in this chapter we're getting into pathogenic fungi. Now, fungi itself, there's a whole group of fungi out there. There's over 100,000 different species of fungi. Majority of them are just decomposing organisms, not causing us any problems. They're great for the environment, but the ones that we are most concerned about that we're going to start discussing, we won't get through all of them, is they're less than 200, and I'm like, so out of the 100,000 species of fungi, less than 200 actually cause disease in humans, and we're going to go through some of the most common of those. Now, fungi themselves have two forms. They have a sexual form and an asexual form, which means sometimes they can reproduce on their own, sometimes they can reproduce using the genetics of other organisms. It makes them great at adapting to their environment. Now, in this PowerPoint, I'm like, we're going to go over medical mycology, the true human pathogens. These are the ones that are going to cause problems in humans. And I'm like, even if they're you're the healthiest person, the opportunistic fungal pathogens, usually affecting those that are immunocompromised, and then some of those skin fungi, the superficial, cutaneous, and subcutaneous mycoses. Now, medical mycology, which is what we're focusing on the fungi, and I'm like, they're going to cause problems in humans. So it's the diagnosis, management, and prevention of fungal diseases, the ones that are infecting humans. Now, the problem with mycoses, and anything that has MYC in it, has to do with fungi. And I'm like, so anything with mycoses themselves are difficult to diagnose, mostly because the signs are often missed or misinterpreted. And when we start getting into some of these specific fungi, their symptoms resemble a lot of different types of bacterial and viral type of diseases. And so a lot of times, and I'm like, if you go to the doctor with certain symptoms, a lot of times they're misdiagnosed because they assume they're, fungi infections are rarer. And so right away, they're going to assume the easiest solution, which is a bacteria or a virus. And what's happening, just like with bacteria, is a lot of these fungi are starting to become resistant to antifungal agents. Now, fungi and spores are everywhere. They are in water, they are in the atmosphere, they're living in plants, they're on animals, they are truly everywhere. How we pick them up, we acquire them through inhalation because they're in the air. We acquire them by trauma. So if we've got open wounds and they get into open wounds, or we ingest them, we eat them. And I'm like, they're in their water supply and we drink them. Now, because we get them from outside sources, and I'm like, most are not contagious. It's one of those, we picked it up from an outside source, it's not spreading from person to person. The exception to that are the dermatophytes. And I'm like, these are ones that can affect the skin, that yes, some of these can spread from skin to skin contact. Now, there are occasionally that we do have epidemics where a whole bunch of individuals are suffering from the same fungal disease. And so a lot of times people assume that it's being spread from person to person. It's usually not that, because most of them are not contagious, so it's usually not that. It's usually just that a whole bunch of individuals were all exposed at the same time. They all had the same environmental exposure. It happens that you can get fungal spores in buildings, in air conditioners, and then it spreads throughout the entire building. And they're not reportable. When you go to the doctor and they diagnose you with a fungal disease, it's not reported to the CDC, it's hard to track. And I'm like, we don't know if there's a lot of epidemics, we don't know if there are more cases, I'm like, we're not keeping track of all of these fungal diseases. Now, for the true fungal pathogens that we'll get to in lecture, there's only 4 fungal pathogens. That means, these are 4 different groups that cause disease in healthy individuals. They are a true pathogen. They don't care if you're healthy, they will still cause disease. And lucky for us, they're endemic or found in the Americas, north and south. And I'm like, so they're not somewhere where you have to travel super far to be able to pick up some of these fungal diseases. Now, other fungi are opportunistic, which means you usually have to have something else going on in your body. And there are kind of 4 different things that put you at an increased risk of picking up an opportunistic fungi. You have a medical procedure, so it's something that's going to allow these fungi pretty much an opening to get in. if you're undergoing some other type of medical therapy, whether it's radiation, some type of immunosuppressive, some type of long-term antibacterial, and I'm like, something else that your body's dealing with that allows these fungi to take hold. If you're suffering from some other type of disease, diabetes, burns, some other types of cancers, AIDS puts you at a higher risk, and even your lifestyle factors. If you're undernourished, you have poor hygiene, you use drugs, and like IV drug use, those are all things that put you at a higher risk of picking up some of these opportunistic fungi. Now, with fungi, how many spores get into your body and the combination of your immune system status do relate to how severe of a fungal infection you actually suffer from. If you only get a few spores in and you're a healthy individual, you probably don't have a big, huge fungal outbreak. If you get a lot of spores in your body and have a poor immune system, you're going to have a more severe fungal infection. Now, diagnosing patients with a fungal disease, I'm like, the first big clue that points any type of doctor or medical professional to a fungal disease is a patient's history. They're going to want to know, what have you been doing? Do you have any specific hobbies? Have you traveled anywhere particular? Again, mycoses, these fungal diseases, are not routinely tested. Generally, it's bacterial and viruses that are tested all the time. But if you've got other things that put you at a higher risk for picking up a fungus, you have to let the doctor know. Now, if they do want to grow up and see if it's a fungal infection instead of a bacterial, one thing they can do in the lab is they can use the sabrodextrose agar. It's a selective agar. It's got antibacterials in it that inhibit bacterial growth. And so bacteria aren't going to grow on this agar. Instead, if there are fungi there, if there are fungal spores, they will grow. So we do have a selective agar specifically for fungi. Other techniques, we're going to be looking for those fungal spores, for those fungal cells. And some of this, if we're looking for one of those skin fungi, they can use a potassium hydroxide, which will dissolve keratin in the skin and allows you to just specifically look for the fungal cells, to actually look for these. And I'm like, they're a lot larger than a bacteria. I'm like, we've looked at yeast, that's a fungus, and I'm like, and you can see they're a lot larger. A lot of times you'll see budding on them, but not all the fungi bud like yeast do. And I'm like, but we can actually look for those fungal spores to diagnose a patient. Now, treatment, and I'm like, it's starting to get more difficult. Again, they're starting to become resistant. And these, fungi themselves resist our T-cell mediated immune response. It means our T cells that are looking for any of those intracellular pathogens, these fungi are resistant to that part of the immune system. And they're similar biochemically. They're a eukaryotic organism. They have a nucleus, and they're a little more similar to us. And so anytime we do any certain type of drugs to kill fungi, they can actually harm healthy cells in our body, which usually leads to some type of side effects like a headache or rash or liver or kidney damage, upset stomach. And these are all side effects because a lot of times when you're killing fungi, you could be damaging some of our normal healthy cells. Now, a lot of the drugs that we do have on the market target one specific molecule found in the membrane of fungi. It's a lipid molecule called ergosterol. Now, it embeds itself right in that phospholipid membrane on the outside of the fungi, and it somewhat resembles something we have in our cell membrane, even sounds a little bit like it, that's embedded. It's a lipid embedded in our membrane called cholesterol. Now, what the ergosterol is, so it is unique to fungi, but it is slightly similar to cholesterol, is that a lot of these drugs, including the most common one, amphotericin B, target ergosterol. And anywhere there's ergosterol, it inserts these pores or channels in these membrane cells, which is not good for the actual cell itself. Now you have holes where you're not supposed to have holes. Things are going to get out that shouldn't get out. Things are going to get in that shouldn't get in. It's bad for the fungus. And I'm like, now amphotericin B truly is our gold standard drug. And I'm like, it is the most effective drug we have that targets those ergosterols and inserts the channels. The problem is, it also has the nickname of amphoterrible because, yes, it can have some side effects because, again, it may target some cholesterol as well in some of our normal healthy cells and insert channels and cause damage. And so I'm like, it is our best drug we have on the market, but it's not without side effects. Now, for most opportunistic infections, it's usually treatment consists of a two-step treatment. A high dose of an antifungal just to decrease the number of pathogens that are in around the body, and then a long-term low dose that prevents new infections. It's not uncommon to take antifungal medications for months. Again, most antibacterial, you're done 7 to 10 days, tops 14 days. It's not uncommon for antifungals to be taken for months. A lot of times it's low doses, not cause too much damage, kill the fungus, and prevent them from getting back inside the body. Now, ideally, we just wouldn't get fungal infections at all, and they are trying to develop some vaccines against some of these fungi from taking hold. Now, problem with it, they're difficult to develop because their metabolism, how they work, are similar to our cells. And so as we start finding ways to wake up our immune system for these foreign invaders, well, our immune system might start to think normal healthy cells are invaders. So they're difficult to develop, but we are getting some on the market. We do have vaccines against some coccidioids, blastomycosis, and candida. Not all species of any of these. There's lots of species in these genus. And I'm like, but we are getting a few vaccines in the market. Now, we are going to stop right there. I know it's just a quick little intro. In lecture, we'll actually start talking about some of these pathogenic, these true pathogens that are affecting the body.